Neurosurgery is a medical specialty that focuses on the diagnosis, treatment, and management of conditions that affect the nervous system, including the brain, spinal cord, and peripheral nerves. Neurosurgeons are highly trained physicians who have completed medical school, a residency in neurological surgery, and often additional fellowship training in a specific area of neurosurgery. They use surgical and non-surgical approaches to treat a variety of neurological conditions, including brain tumors, spinal cord injuries, cerebrovascular disease, traumatic injuries, and functional disorders. Neurosurgery involves delicate procedures that require a high level of precision and skill. Some of the most common procedures performed by neurosurgeons include brain surgery, spine surgery, and stereotactic radiosurgery. The goal of neurosurgery is to improve patients' quality of life by relieving symptoms, preventing or slowing disease progression, and restoring neurological function. Plastic surgery is a surgical specialty that involves the restoration, reconstruction, or alteration of the body's form and function. It can be performed on almost any area of the body, including the head and neck, face, breast, trunk, and extremities. Plastic surgery can be divided into two main categories: reconstructive surgery and cosmetic surgery. Reconstructive surgery aims to restore the form and function of body parts that have been affected by congenital defects, developmental abnormalities, trauma, infection, tumors, or disease. Examples of reconstructive procedures include breast reconstruction after mastectomy, skin grafts for burn victims, and cleft lip and palate repair. Cosmetic surgery, on the other hand, focuses on enhancing or improving a person's appearance. It includes procedures such as breast augmentation, rhinoplasty, nose job, liposuction, facelift, and eyelid surgery. Cosmetic surgery is usually elective, meaning it is done by choice rather than for medical reasons. Plastic surgeons are highly trained medical professionals who have completed a rigorous training program that includes medical school, residency training in general surgery and plastic surgery, and often additional fellowship training in a specific area of plastic surgery. They use a variety of surgical techniques and technologies to achieve optimal results while minimizing risks and complications. Dermatology is a medical specialty that focuses on the diagnosis, treatment, and management of conditions that affect the skin, hair, and nails. Dermatologists are medical doctors who specialize in skin care, and they diagnose and treat a wide range of skin conditions, from acne and eczema to skin cancer and psoriasis. Dermatologists use a variety of techniques to diagnose skin conditions, including visual examination, skin biopsies, and other laboratory tests. They may also use advanced imaging technologies like dermoscopy, which allows them to examine the skin at a microscopic level. Treatment options for skin conditions vary depending on the specific condition and its severity. Dermatologists may prescribe medications like antibiotics, antifungals, or corticosteroids to treat skin conditions, or they may recommend non-invasive treatments like light therapy or topical creams. In some cases, more invasive treatments like surgery or cryotherapy, freezing of tissue, may be necessary. Dermatology also includes cosmetic dermatology, which focuses on improving the appearance of the skin. Cosmetic dermatology procedures include Botox injections, dermal fillers, laser therapy, and chemical peels. These procedures are often done on an elective basis to help patients achieve a more youthful or attractive appearance. Orthopedics, also known as orthopedic surgery, is a medical specialty that focuses on the diagnosis, treatment, and prevention of conditions related to the musculoskeletal system. This includes bones, joints, muscles, tendons, and ligaments. Orthopedic surgeons are medical doctors who specialize in the musculoskeletal system and its associated conditions. They are trained to diagnose and treat a wide range of musculoskeletal conditions, including sports injuries, arthritis, spine disorders, trauma, and congenital disorders. Orthopedic surgery can involve both surgical and non-surgical treatments. Non-surgical treatments may include physical therapy, medications, and other interventions. Surgical treatments may include joint replacement surgery, arthroscopy, spinal fusion, and other procedures. Orthopedic surgeons also work closely with other healthcare providers, including physical therapists, to provide comprehensive care for patients with musculoskeletal conditions. They often work in hospitals, clinics, and private practices. Orthopedics is a constantly evolving field, with new techniques and technologies being developed all the time. Advances in orthopedic surgery have led to improved outcomes and faster recovery times for many patients. Diagnostic radiology is a medical specialty that uses medical imaging techniques to diagnose and treat diseases and injuries. Radiologists are physicians who specialize in diagnostic radiology and are trained to interpret medical images. Diagnostic radiology involves a variety of imaging techniques, including X-rays, computed tomography, CT, scans, magnetic resonance imaging, MRI, ultrasound, and nuclear medicine. Each of these techniques provides different types of images that can help diagnose a wide range of medical conditions. Radiologists use these imaging techniques to help diagnose and treat a variety of medical conditions, including fractures, tumors, infections, and other diseases. They also play an important role in screening for diseases such as breast cancer and colon cancer. In addition to interpreting medical images, radiologists work closely with other healthcare providers to develop treatment plans for patients. They may also perform minimally invasive procedures, such as biopsies and image-guided injections, to help diagnose and treat medical conditions. Diagnostic radiology is a rapidly evolving field, with new imaging technologies and techniques being developed all the time. These advances have led to improved diagnostic accuracy and more targeted treatments for many medical conditions. Interventional radiology is a medical specialty that uses minimally invasive procedures to diagnose and treat a variety of medical conditions. Interventional radiologists are physicians who specialize in this field and are trained to perform these procedures using imaging techniques such as X-rays, CT scans, MRI, and ultrasound. Interventional radiology procedures are typically done through small incisions, using catheters and other specialized instruments. This allows for faster recovery times, less pain, and fewer complications than traditional surgery. Interventional radiology procedures can be used to treat a wide range of medical conditions, including cancer, vascular disease, and liver disease. Some common interventional radiology procedures include angioplasty and stenting to treat blocked arteries, embolization to treat tumors and aneurysms, and drainage procedures to remove fluid from the body. Interventional radiologists work closely with other healthcare providers, including oncologists and surgeons, to provide comprehensive care for patients. They often work in hospitals, clinics, and outpatient centers. Interventional radiology is a rapidly evolving field, with new techniques and technologies being developed all the time. These advances have led to improved outcomes and less invasive treatments for many medical conditions. Cardiothoracic surgery is a medical specialty that focuses on the surgical treatment of diseases affecting the heart, lungs, and other organs in the chest. Cardiothoracic surgeons are highly trained medical doctors who specialize in this field and perform a variety of complex surgical procedures. Cardiothoracic surgery procedures include coronary artery bypass grafting, CABG, heart valve repair or replacement, heart transplantation, lung transplantation, and other surgeries related to the chest cavity. These surgeries may be performed on patients with congenital heart defects, coronary artery disease, lung cancer, or other conditions affecting the heart or lungs. Cardiothoracic surgeons work closely with other healthcare providers, including cardiologists, pulmonologists, and anesthesiologists, to provide comprehensive care for patients. They often work in hospitals, where they perform surgeries in specialized operating rooms equipped with the latest technology and equipment. Cardiothoracic surgery is a highly specialized field, and procedures are often complex and require a high level of expertise. However, advances in surgical techniques and technology have led to improved outcomes and faster recovery times for many patients. Thoracic surgery is a medical specialty that focuses on the surgical treatment of diseases and injuries affecting the chest, including the lungs, esophagus, and other organs in the chest cavity. Thoracic surgeons are highly trained medical doctors who specialize in this field and perform a variety of complex surgical procedures. Thoracic surgery procedures include lung resection, esophageal surgery, tracheal surgery, and other surgeries related to the chest cavity. These surgeries may be performed on patients with lung cancer, esophageal cancer, lung infections, collapsed lungs, and other conditions affecting the chest cavity. Thoracic surgeons work closely with other healthcare providers, including pulmonologists and oncologists, to provide comprehensive care for patients. They often work in hospitals, where they perform surgeries in specialized operating rooms equipped with the latest technology and equipment. Thoracic surgery is a highly specialized field, and procedures are often complex and require a high level of expertise. However, advances in surgical techniques and technology have led to improved outcomes and faster recovery times for many patients. Child neurology, also known as pediatric neurology, is a medical specialty that focuses on the diagnosis and treatment of neurological disorders in children. Child neurologists are highly trained medical doctors who specialize in this field and work with children from birth through adolescence. Child neurology disorders can affect the brain, spinal cord, and nerves throughout the body. Some common conditions treated by child neurologists include epilepsy, migraine headaches, developmental delays, cerebral palsy, and neurogenetic disorders. Child neurologists work closely with other healthcare providers, including pediatricians, neurosurgeons, and physical and occupational therapists, to provide comprehensive care for children with neurological conditions. They may use a variety of diagnostic tests, including electroencephalography, EEG, magnetic resonance imaging, MRI, and computed tomography, CT, scans, to help diagnose and manage these conditions. Child neurology is a rapidly evolving field, with new treatments and technologies being developed all the time. These advances have led to improved outcomes and better quality of life for many children with neurological disorders.